So what exactly is mindfulness? Jon Kabat-Zinn, professor of medicine at the University of Massachusetts Medical School, who's been largely responsible for bringing this ancient practice to medical centers worldwide, uses this definition. Mindfulness is about paying attention on purpose, in the present moment, non-judgmentally. Research has shown that mindfulness is a practice that helps us cope with our daily stresses and manage stress. It brings us back to a greater state of balance. And in a state of balance, we're able to experience more joy, connect with people, do better work, and make better decisions. That is why in June, Kyla launched the 30-day Mindfulness Challenge, and the results were great. 431 staff signed up to participate in this program. These were the results at the end of the challenge. More importantly, here's what our staff had to say about the experience.
I get really stressed in my job from the constant demands, but I am now able to step back and take 5. It really helps.
I am now much more calm, patient, and non-judgmental.
The benefits have been beyond my expectations. Mindfulness is a life skill that everybody needs. I only wish I had done this sooner. Thank you.
It's a great way to center yourself and bring yourself back to the present moment.
Here at Halton Healthcare, I'm in the social work department, and I figure what I tell my patients, I may as well practice what I preach. So obviously mindfulness is one of the skills that we do teach people, and it is quite important, and it's always good to get some experience actually practicing it. So I thought this was a great opportunity.
Mindfulness excited me because it was education about myself and my own mind, and we never learn about that.
Change in healthcare comes all the time, and sometimes figuring out how to manage it can be challenging. So it was a great tool for me to manage that transition into my new role.
It gave me something to think about.
What I found was it actually provided me with, I would think, more time in my day, because I was able to manage my stress in little pieces and then move on to the things I needed to get done to do what I needed to do in my new role.
I would advise somebody to really take the mindfulness challenge seriously.
It doesn't take very long at all. It's easy to do, and it's very effective. It's just remembering to do it. So when you work that into your cues of your daily life, it's very simple.
And it's just that shift that allows us to put some of those things aside, bring to work what we need to be there to maximize how we can be that healthcare provider that makes a difference, not only in our patients' experiences, but each other as colleagues.
In Matt Newborn, we have situations where it's so sad because we deal with death, and it's neonatal death. And it's very hard because that's just not the nature, that's not the way it was meant to be, right? And so, oh, it gets me all tearful. But you have to deal with that situation, and then when that person is gone, and then when that baby is like gone from your department, you have to put a happy face back on and walk into another patient's room, because she's gonna have a live birth. And as in a leadership position, I think that mindfulness has helped me to help my colleagues and my peers, to help them through that, because it's very difficult.
What I really enjoyed about it was the fact that, you know, you moved through it in bits and pieces. It was really easy to get through. It didn't take up a big amount of your day, and because it was so structured, it was easy. I didn't have to think a lot about it. I would go to it, kind of make my way through it, enjoy the experience, and then try to apply it through my day, but it didn't seem overwhelming.
I would just highly recommend it.
I will absolutely do it again. I think, you know, that constant reinforcement of good habits is always important. And you learn something new every time you do it. Things may seem overwhelming, or you may have missed a piece. So it's important to do things like this that are good for you over and over again. We exercise regularly, we eat good food regularly, and we should be doing mindfulness exercises regularly to keep our, you know, self healthy and happy.
I can do this. It works.
I would like to extend the challenge to all of leadership because I think it's something that you need to try for yourself. Once you've tried it, you'll see the benefits and you'll be able to lead by example and promote it to all staff across the organization. I think it's very beneficial.
I would encourage people to at least give it a go.
It's something you can fit in easily. It will really help you move forward with what you're doing and dealing with your stress. And really, what have you got to lose by trying it? You could do it at your own time. You could do it at your own pace. It's just a nice way to kind of top off your day and make sure that you're getting where you need to do for your own wellness. And that's an important part of healthcare. It's a tough environment. So taking care of yourself first is important so that we can take care of the patients that we serve in our community.
Just give it a try. You've got nothing to lose except stress.
So if you wished you had participated in the last challenge or would like to do it again, you now have another chance to try it. And don't forget, this is also a great way to empower your team. Kylo is launching another 30-day mindfulness challenge. So sign up today and get the rest of your team to sign up with you.
Disclaimer: do not participate in this program if you enjoy the nattering, chattering, negative voice in your head. Believe high moments of stress are exhilarating, that nights of insomnia are the ideal way to get more work done. Feeling anxious is time well spent, and conflicts with others are so much fun. Side effects of this program may include feeling less stress, anxiety, and depression, as well as experiencing an increase in focus, joy, creativity, compassion, concentration, productivity, and connection with others.